Hello everyone, my name is Dr.Anas Hasan. I'm from Iraq and I'm delightful today to host my big brother and friend, Dr.Sam from Belgium. And I will leave the mic for him to introduce himself.
Thanks, Anas, for having me. As you said, I'm working in the city center of Brussels, the heart of Europe. And like you, I'm dedicated to men's health and helping men who suffer with erectile dysfunction, fertility issues, sexual desire. So, yes. And there are a lot of men suffering.
Okay. So welcome here. Can you tell us today what about the event that is gathering us for the second time here in Istanbul?
Yeah, so this is the second Rigicon Academy, and Rigicon is a factory that is dedicated to urologic care for patients, and they are one of the most important penile implants in the industry. And they have gathered top experts from around the world, from United States, Europe, Middle East, and we're all here together to share our knowledge, to learn from each other, because at any age you can still learn, and that's what we're doing. And it has been a tremendous morning, and we'll continue this afternoon.
So a lot of our patients, they are saying, why do you be in these meetings? What is the benefit to the patients?
That's very important, because what you learn when you're a young physician changes over time. Surgical techniques change. Tips and tricks change. Troubleshooting is very important. As you have more and more patients, they come back after some years, there are some issues. And of course, you learned everything theoretically, but you can learn from your peers, from your colleagues.
Sharing ideas. Instead of you going to create a new idea, maybe Sam had an idea maybe 2 years ago, and you can use it in your operation, and you will improve your technique.
Exactly. What works for someone else can work for you too. And as I just said in my presentation, copying is allowed, so you have to learn from your colleagues and friends from abroad.
So I think you just saw my lecture.
Yes.
And I would like to know, what do you think about our work in Iraq within the last 4 years?
I think you're probably the most dedicated guy for men's health in Iraq, and your numbers are incredible. You have a 500% increase in less than 5 years.
True.
So, really congratulations for that. And I think that you did a shift that a lot of young surgeons do. In the beginning, we all start by putting malleable in, and then we notice that, inflatable is very good. And it mimics the normal physiological response of having a flat penis when you don't have any sexual desire, and whenever you want to have intercourse, then you can pump it up. And that's the difference with malleable. And so in my practice, I also prefer always to have inflatable penile implants.
So in your practice, you don't do malleables at all?
No, of course, everyone does malleable, but we keep it for a certain, it's important to tailor the solution for the patient. And for most of the patient, I think inflatable first. But that doesn't mean that malleable is a bad solution. Malleable is a great solution for many patients, but tailor it and offer inflatable first. I think that's really important.
What I know from what I hear from you in Europe, that inflatables are reimbursed. In some countries, malleable are not reimbursed. Is that true?
Yes, actually, it's a very fun fact, and especially in Belgium. In Belgium, inflatable is almost totally reimbursed, 75% reimbursed, and malleable is not reimbursed at all. So that, of course, helps us in a way. But the real question is it worth the money? Is it worth the investment? Without any doubt.
Yes, yes. So we have a lot of questions from the patients. Because you're an expert, and you are doing that surgery maybe in Belgium for more than 30 years now. I mean, like your mentors and
Yes. I'm still quite young, but we've been doing implants in Belgium for the past 3 decades. Koenraad, my mentor, and Robert Andrien, which a lot of people know. And I'm dedicated for the last decade. I have been dedicated, and so yes, we can learn from our colleagues.
What do you think about the long-term satisfaction with the implants?
This has been shown in so many studies and publications, because that's very important. What we do in men's health, we are very dedicated and we keep all our data. And sometimes we publish it, but we also share it among our friends and colleagues at these events like today. And satisfaction, and not only patient satisfaction, but couple satisfaction is really, really high. We're talking 95, 96% satisfaction for penile implant. And also, if you do sphincters, you know, for incontinence, satisfaction is so high. And it's a bit sad. We all know that so many patients could benefit from this solution, and either they don't know that it exists, or no one has told them. And so I think we have a big mission, is to share our knowledge among, you know, not only patients but citizens.
So do we need to put responsibility sometimes on a patient to choose the right surgeon? What's the difference between a good surgeon and an exceptional surgeon?
Well, you know, the more you do, the better it is. And I mean, you're #1 in Iraq, so for sure. And you've shown the results, and you have almost no infections. And that is, of course, because of your dedicated work. And that is what we all try to do in Europe, in the Middle East, and beyond. We try to dedicate to do only this work and to improve our results.
So actually, we are honored here to be with Dr. Sam again in Istanbul. I have seen him in California, I've seen him in Istanbul last year, and I would love to see him again and again. So thank you for...
Well, maybe one day in Iraq, Hasan, if you invite me.
That's the next sentence, because we are trying to have you guys in Iraq. Maybe we can scrub together.
Yes.
And you will enjoy our mazgoof, the traditional fish.
I'm looking forward to it.
We would love to have you in Baghdad someday.
Thank you.
Thank you for your time.
Thank you so much.